I was actually watching a launch for a very exciting new health AI company, and I was speaking to a lot of startup founders. And when you're listening to them, sometimes you feel a bit bombarded. They are talking about their technology with an incredible passion. They are talking about the features, and it's quite rapid fire. It's a bit intense. And I've also heard this from on the other side. I was having a conversation with a hospital CIO, and he was saying that often when he hears from new technology vendors, especially in the health AI space, he doesn't understand the context of where he fits in, what they want, where's this conversation going? And I'm wondering, this is kind of like a fundamental problem that a lot of startups founders have. They're making the shift from talking amongst each other to other people.
Mm.
They have to change their language when they do that. And I'm wondering if you can give some advice.
Yes, of course. So the analogy I like is that the developer, the tech engineer, you've had your head down on the Monopoly board. I don't understand all the gizmos and widgets and whatever you move around, but you've had your head down here. Now it's time to look up and speak to the other person on the other side of the Monopoly board. And they are not a Monopoly piece. They are your mum. They are your granny. They are your son. And they want you to connect with them in a language that they can understand and receive. See, people don't buy into medicine. They don't buy into physiotherapy. They're buying into an idea. They're buying into a trust and a confidence that what you offer is going to create a brighter future for them. And it's that feeling, that belief that your solution is going to make their lives easier, less painful, less difficult, more meaningful, that's important to them. And that's what's going to bind everything together in your business. Because the dark force you're going to be battling with is that you want your tech to be the hero of the story. And it's not. It never, ever is. We're going to flip to Cinderella for a moment. Can you imagine if that fairy godmother's wand was suddenly the main protagonist in the story? It would have just become another ugly sister. It would have just become another villain, competing with Cinder's for attention. Now that wand has got to work. It's got to deliver on time. What you've got the interval of about 10, 15 minutes for that wand to create a beautiful dress, conjure up a carriage and some footmen and everything else. So it's got to work. It's got to deliver. But it's a prop. And it will get the product placement that you want your tech to have if it does its job well. Everybody knows the fairy godmother's wand. Everybody knows the car in Back to the Future. Everybody knows when the tech has worked well, but it's never the hero of the story. And so the patient that you're wishing to help, I would like you to imagine is your mother. Because nobody wakes up in the morning or in a hospital bed, at home, in a care home, wishing they had another tech solution or another AI solution in their life. They wake up wishing somebody would just help them wash their hair because that will make them feel another $1,000,000. Somebody will just bring them a piece of fresh fruit or some homemade tomato soup rather than the junk they're getting here. Somebody will hold their hand, massage their feet because it's weeks since they saw their toes. They want to know that somebody will help them get into a chair again so they might see blue sky again. They might get outside and smell sea air once more. They didn't consent. They didn't consent to neglect by your tech. And that's a really important point. People have to consent to every single intervention that they receive in healthcare. But do they consent to neglect? And do they consent to neglect by computer? And I very, very much doubt your mother did that. And if she's not able to consent for herself, I doubt you consented to that for her.